The symptoms of acid reflux and heartburn are caused by stomach acid flowing back into the esophagus. In addition to antacids and histamine 2 blockers, another class of medication called proton pump inhibitor or PPI also helps relieve heartburn. Over-the-counter PPIs include omeprazole, pantoprazole, lansoprazole, and Zegerid OTC. Similar to histamine 2 blockers, the PPIs alleviate symptoms of acid reflux by decreasing the acidity of the stomach fluid. This cartoon illustrates the mechanism of how PPIs suppress the acid release from the stomach. When parietal cells, which line the inside of the stomach lumen, are stimulated by histamine, acetylcholine, and gastrin, series of cascades of events occur inside the parietal cells, leading to the translocation of proton pump from inside the cells to the cell surface. The proton pump subsequently pumps hydrogen ions into the stomach lumen, resulting in a significant increase of the acid level in the stomach fluid. PPIs bind to and irreversibly inhibit proton pump and reduces stomach acid output by about 66%. All of the over-the-counter PPIs are similarly effective in heartburn relief. I'm going to use one of the PPIs, omeprazole, to discuss the details of this class of medication. It is recommended to take omeprazole 30 minutes before breakfast or eating. It takes 1 to 4 days for the medication to be fully effective. The effect of the omeprazole lasts over 24 hours. Due to the increased bioavailability of PPIs, people of Asian ethnicity, patients with liver impairment, and older people should start lower dosage. You should consult your physician if you need to take the medication for more than 2 weeks. You should always inform your physician when you take an over-the-counter PPI because this class of medication may interact with other medications. At Walmart, 20 mg Prilosec OTC costs 54.7 cents a tablet. The generic omeprazole costs less at 35.6 cents per capsule. If you have a prescription, you can buy 40 mg generic omeprazole at less than 20 cents a capsule at some pharmacies with a good RX coupon. In general, proton pump inhibitors are relatively expensive. For example, Nexium costs 56 cents a piece. The generic S-omeprazole is about 40% less at 35 cents a capsule. Similarly, Prevacid costs 54 cents per piece, and the generic lansoprazole is priced at 31 cents a capsule. Zegerid OTC is unique. It has both the ingredients of 20 mg omeprazole and 1100 mg sodium bicarbonate. The sodium bicarbonate protects omeprazole from the acid inside the stomach. Each capsule contains 303 mg of sodium. You may need to avoid Zegerid if you are on sodium restriction. At Walmart, 42 capsules of Zegerid cost $22 at 54 cents a piece. With a prescription, the price of Zegerid OTC after good RX coupon is 33 cents a capsule at Walgreens. There are potential risks associated with long-term use of PPIs. PPIs may lower magnesium level. Low magnesium can increase the risk of muscle spasms, seizure, muscle weakness, delirium, and irregular heartbeat. PPI may also increase the risk of Clostridioides difficile infection, which causes severe diarrhea and an inflammation of the colon. PPI may also be associated with other intestine infections and pneumonia. Vitamin B12 and iron deficiency have been reported with prolonged PPI use. The medications may increase the risks of acute and chronic kidney disease. PPI may be associated with fractures of the hip, wrist, and spine. You are at higher risk of fracture if you are age 50 years and older, if you take high doses of PPI or use it for 1 year or longer. Lupus may occur or get worse in people taking a PPI. Long-term use of PPI may also cause rebound acid secretion. This is a phenomenon in which the discontinuation of PPIs after prolonged use results in stomach acid levels higher than before the initiation of PPIs. Because of the potential long-term risks of taking a PPI, it is recommended that you take the lowest dose for as short a time as possible. In summary, PPIs help relieve symptoms of acid reflux and heartburn by suppressing acid release from the stomach. All of the over-the-counter PPIs are similarly effective. The dosage of the PPIs needs to be lowered in the Asian population, patients with liver impairment, and older people. Long-term use of PPIs is associated with increased risks of many medical conditions. Therefore, PPIs should be taken at the lowest effective dose for the shortest duration.